That's right. Dr. Joel Conn from Pismo Beach Veterinary Clinic joins us this morning with more on brushing your pet's teeth, and it can be sometimes a little bit difficult for them to allow you to do that.
Yeah, so I thought today we'd talk about things to look for and things that you can kind of do at home to manage your pet's dental health, and then next time we'll talk a little bit about the scary dental cleanings and why they don't have to be scary.
Okay. Right. I need to listen up.
So signs of dental disease is pretty straightforward. Bad breath, that's a huge one. So if you cringe or almost pass out when your dog licks your face, it may be time to clean those teeth. Loose teeth, you know, sometimes I have owners that will even see their pet's teeth fall out. Oh. That's definitely a bad sign. Tartar, gum redness, if you look in your pet's mouth, are the gums cherry red? Do they blanch easily when you push on them? And even discharge or bleeding from the gums, you know, especially after a rawhide or hard treat. Drooling excessively, eating out of one side of the mouth, or difficulty eating, or food falling from the mouth can indicate pain. This is something we'll see more in cats, too, that have a lot of painful dental conditions. And then, you know, just a tendency to shy away when you try to look in their mouth. And then one of the big things, and this is usually the last thing to occur, is decreased appetite. It takes a lot to decrease, especially a dog's appetite.
All right.
Yeah.
So the big thing here is that, you know, in many cases there may be few or no symptoms outward that your pet has bad teeth. So you want to make sure once a year you're getting in for a dental evaluation from your veterinarian. Okay. So beyond that, though, there's lots that you can do at home. And I know, Randall, you've probably started brushing your dog's teeth on a daily basis.
I think he's having this whole segment for me because I know that I'm supposed to do it, but it's one of those things where they don't like it. So it's, you know, are we supposed to do it daily?
Well, so brushing is best. That's the best thing you can do, just like with us. Here's an example of how I recommend doing it. First of all, you want to work up slowly. Now, this is one of my technician's dogs, so it's an unfair advantage. But what I start with is, first of all, you want to use a veterinary dental toothpaste designed for dogs and cats so they can swallow it. Colgate, Crest, they're not supposed to swallow. It's actually mildly toxic. And I start by literally getting some on my finger, and it's usually chicken or fish or beef or malt flavored. Make sure your pet likes it. If the pet doesn't like it, you're doomed from the beginning. And just start by just offering it as a treat, brushing just one tooth just with your finger to start with. And then as you kind of work up to it, you can start actually brushing. And what I do is I partially hold the mouth shut just to avoid them chewing on the brush the whole time, makes your life a little easier. They'll kind of lick the whole time you're doing it. And then going blindly under the lip. And I use in most dogs, and even in cats, I use a long-handled toothbrush with a small soft bristles on the end. And you're just doing circular motions, just like your dentist tells you, about 30 seconds a side, concentrating to make sure you get all the way to the back. So I'm actually under this dog, this is Bree, under her eyeball. So you're all the way at the back of the mouth on those fourth premolars and molars, and then there's that big fang in the front. That's one that gets a lot of tartar too. Work your way to the front. You don't have to do the insides. The tongue kind of brushes those for you.
Oh, okay. Doctor, is there fear of doing more harm than good? Like if you just are... I'm always kind of concerned I'm going to like hurt the gums or something.
Yeah, I mean, I think especially when you're starting with an animal that already has significant dental disease, you're going to see some bleeding and that kind of thing. So you start out small and you make it a rewarding experience. So if your animal's shying away from you and acting like, hey, that hurts, just do, you know, a few seconds just to get them used to the experience, and then give them a treat or feed them afterwards, you know, make it rewarding. And some animals, if you do it right, will even kind of look forward to it as a bonding experience or kind of a treat. And your veterinarian can give you tips on that too. If you can't brush, there are some other things you can do that are kind of the next step down. There are some veterinary dental diets. So this is a Science Diet product called TD. The idea behind these diets is the kibble is a texture that sort of is semi-firm. So as the tooth goes through the kibble, it scrapes along the enamel surface and breaks off that tartar.
Oh, okay.
So it's not just a hard food. It's actually it's sort of a semi-soft food. And there's several prescription diets out there. You want to make sure that these have a seal of approval from VOHC, which is a Veterinary Oral Health Council.
VOHC.
That's right. And that's a way to help you evaluate a lot of the over-the-counter dental products. There are dental rinses. CET makes one, which is a chlorhexidine-based rinse. You can actually just squirt it on the mouth, and just by being on there's an enzymatic effect, antibacterial, helps freshen breath. There's dental treats you can get, all sorts of things that are
You can just leave that
easier.
for me. I'll take that home for my dog.
Yeah, you were saying your dog
he
lately.
had some interesting breath over the weekend, so I was really looking forward to this segment. So I was going, what is going on?
A lot of people, I know there are people glued right now watching because they're like, you know, it's something you know you need to take care of, but just sort of need.
And now's a great time. February is actually National Pet Dental Health Month, so most veterinarians are doing sort of a promotional discount on dental exams and dental cleanings.
Okay.
You know, we're at Pismo Beach Vet, we're doing 15% off just to encourage people to get in, because money is usually a big hurdle. Get in there, get your teeth evaluated, get some advice. Even if you don't do the cleaning, you can get some advice for over-the-counter solutions.
All right, sounds good. Dr. Joel Conn with Pismo Beach Veterinary Clinic. Ask the Vet at KCOY.com. That's how you can get your questions directly addressed. Thank you so much, sir.